A blood clot can form inside your body without causing obvious symptoms. You may feel completely normal while a clot develops inside a blood vessel. But if that clot blocks blood flow to the lungs, brain, or heart, the situation can become life-threatening within minutes. So how does a normal protective process inside your blood become dangerous? What is a blood clot? Blood normally stays liquid, so it can continuously circulate through your blood vessels. A blood clot forms when blood changes into a thicker, solid mass. Normally, this is a protective response to injury. When a blood vessel is damaged, tiny blood cells called platelets attach to the injured area. They release chemical signals that attract more platelets. Then clotting proteins activate and produce fibrin, a protein that forms a strong mesh around the platelets. This creates a plug that stops bleeding. Normally, the body controls this process and later removes the clot after the vessel heals. The danger begins when a clot forms inside a blood vessel without an injury that needs to be sealed. How does a blood clot form? A dangerous clot becomes more likely when blood flow slows, the vessel wall is damaged, or the blood becomes unusually prone to clotting. Slow blood flow is especially important in the deep veins of the legs. Long periods of immobility, such as after surgery or during prolonged sitting, can increase the risk of a deep vein thrombosis or DVT. Blood vessel damage from conditions such as smoking, inflammation, or high blood pressure can also increase the risk. Certain medical conditions, cancers, pregnancy, hormonal medications, and inherited disorders can also make blood more likely to clot. The clot may initially be small enough that blood continues flowing around it. Because circulation is not completely blocked, a person may feel nothing unusual, but the danger can change if the clot grows or breaks away. What causes a blood clot to become dangerous? The danger mainly depends on where the clot is, how large it becomes, and whether it travels. A clot in a deep leg vein may cause swelling, warmth, tenderness, or pain. But some people have very few symptoms. Part of the clot can sometimes break away and enter the bloodstream. This traveling clot is called an embolus. A clot from the leg usually travels toward the heart and then into the arteries supplying the lungs. Clots can also form inside the heart or arteries and travel toward the brain or other organs. Once a clot blocks a blood vessel, the tissue beyond that blockage can lose its oxygen supply, and that is when the clot can begin damaging an organ. What happens when a blood clot blocks blood flow? Cells need oxygen and nutrients delivered by the blood to produce energy and survive. When a clot blocks an artery, blood cannot reach the tissue beyond the blockage normally. Oxygen levels begin falling, and the affected cells start losing their ability to function. If blood flow returns quickly, the tissue may recover. But if the blockage continues, cells can become permanently damaged and die. The effects depend on the organ involved. In the brain, blocked blood flow can cause weakness, speech problems, vision changes, confusion, or loss of coordination. In the heart, it can damage heart muscle. In an arm or leg, severe blockage can cause pain, numbness, weakness, coldness, or changes in color. But when a clot travels to the lungs, the consequences can become especially serious. What happens when a blood clot travels to the lungs? A clot from a deep vein can travel through the veins into the right side of the heart. The heart then pumps it into the pulmonary arteries, which carry blood toward the lungs. If the clot becomes stuck there, it causes a pulmonary embolism. The blockage prevents normal blood flow through part of the lungs. This means blood cannot efficiently receive oxygen from the affected area. The blockage also increases pressure inside the lung circulation. The right side of the heart suddenly has to pump against greater resistance. A small pulmonary embolism may cause shortness of breath, chest discomfort, or a rapid heartbeat. A large blockage can cause severe breathing difficulty, dizziness, fainting, dangerously low blood pressure, and heart failure. In the most severe cases, the heart can no longer pump enough blood through the lungs and into the rest of the body. But the lungs are not the only organs threatened by blood clots. Can a blood clot cause a stroke or heart attack? Yes. A clot can contribute to both a stroke and a heart attack when it blocks blood flow to these organs. An ischemic stroke occurs when an artery supplying the brain becomes blocked. Brain cells beyond the blockage quickly lose oxygen and nutrients. This can cause sudden weakness or numbness, difficulty speaking, vision problems, confusion, or loss of balance. A heart attack can occur when blood flow through a coronary artery becomes blocked. These arteries supply oxygen to the heart muscle. When oxygen delivery falls severely, heart muscle begins to become damaged. This can cause chest pressure, shortness of breath, sweating, nausea, or pain that spreads to the arm, back, neck, or jaw. In both situations, the longer the blockage remains, the greater the risk of permanent damage. So, how do doctors detect and treat these clots? How are blood clots detected and treated? Doctors first evaluate symptoms, medical history, and risk factors. The tests depend on where a clot is suspected. For a DVT, ultrasound can examine blood flow through the veins. For a pulmonary embolism, doctors may use CT pulmonary angiography to look for a blockage in the lung arteries. A blood test called D-dimer can also help determine whether further testing may be needed in appropriate patients. Treatment depends on the clot's location and severity. Anticoagulants, commonly called blood thinners, reduce the blood's ability to form and enlarge clots. They do not immediately dissolve an existing clot. Instead, they prevent it from growing while the body gradually breaks it down. Severe cases may require medications that actively dissolve clots or procedures to remove the blockage. But preventing dangerous clots from forming is even better than treating them. Can blood clots be prevented? Not every blood clot can be prevented, but the risk can often be reduced. Regular movement helps maintain blood flow, especially during long periods of sitting. People at higher risk may need preventive measures during long travel, hospitalization, or recovery after surgery. Avoiding smoking can also reduce risk because smoking damages blood vessels and contributes to conditions associated with abnormal clotting. Some people with high clotting risk may receive preventive blood thinning medication during certain high-risk situations. However, blood thinners can cause serious bleeding, so they are not appropriate for everyone. Prevention depends on understanding the individual's specific risk factors. Can a blood clot really kill you without warning? Yes, a blood clot can become life-threatening with little or no obvious warning. Some clots produce symptoms first. A DVT may cause swelling or pain in one leg. A pulmonary embolism may cause sudden difficulty breathing or chest pain. A stroke may suddenly affect speech, movement, or vision. A heart attack may cause chest pressure, shortness of breath, sweating, or nausea. But symptoms can sometimes be mild or absent until the clot causes a major blockage. The important point is that a clot is not automatically deadly. The real danger comes from where it forms, how large it becomes, whether it travels, and how severely it blocks blood flow. A clot can begin silently in a leg vein, travel through the heart, and suddenly block circulation through the lungs. Another clot can block an artery supplying the brain or heart. So yes, a blood clot can kill someone without much warning, but this happens because the clot suddenly interrupts blood flow to a vital organ. Normally, clotting protects your life by stopping bleeding. The danger begins when that same system forms a clot in the wrong place or allows it to travel somewhere critical.